Tanya Goodman, and I'm currently enrolled in marriage, family, and sex therapy at Troy State University. Today, I'll be giving you a brief overview of psychoeducational family therapy. The definition of psychoeducational family therapy is a therapeutic effort offering an educational programs directed at helping families better understand and learn skills for dealing with a seriously disturbed family member. Psychoeducational programs involve a combination of systems, theories, cognitive behavior therapy, and educational psychology. Psychoeducational efforts are most prominent in working with families where there is a member with a severe mental disorder such as schizophrenia or bipolar disorder. Psychoeducational programs represent a significant development in the field over the last 2 decades. What psychoeducational approaches do have in common with the newer techniques is the effort to build and maintain a therapist-family collaborative partnership. Although psychoeducational family therapy does not, strictly speaking, follow customary family therapy procedures, practitioners do utilize many of the techniques of more traditional family therapy. Psychoeducational family therapy did not derive from any specific theory of family functioning, nor did it adhere to any one set of family therapy techniques. Rather, it is an eclectic approach. Overall, psychoeducational efforts are directed at educating families in how to best maximize their effectiveness as they attempt to cope with the mentally or physically disabled family member or deteriorating family relationships, or perhaps as they simply learn new problem solving techniques for increasing the likelihood of future successful marital relationships. Families and mental disorders. Mental illness in a family can be a ravaging, devastating disease that disrupts a family and permits little opportunity for respite. No family with a mentally ill member can avoid the consequences of the disorder without experiencing some family disruption. Teaching family members how and from whom in the community to obtain mental health, welfare, and medical services is often of great benefit, especially those families that feel helpless and confused when such new roles are thrust upon them. Problem solving therapeutic efforts are intended to ensure family members preserve the integrity of their own lives. The therapeutic process. The therapeutic process can be done by working with individual families or with multiple families simultaneously. Survival skills workshops are set up to teach family members about the course of mental illness, medication, prognosis, and etc. Schizophrenics are usually sensitive to overstimulation. Families are urged to respect boundaries, allowing schizophrenics to withdraw whenever necessary. This respect for individual boundaries is supplemented later by reinforcing or generalization boundaries, as parents are urged to form a stronger bond with one another and together remain in charge, lest the patient needs come to dominate all family decisions. Medical family therapy. Medical family therapy was pioneered by the former head of the Ackerman Institute, Don Block, in 1983. The definition for medical family therapy is coordinated effort by an interdisciplinary team to treat a chronic mental illness, trauma, or disability. This model for family therapy tries to deal with the complex interface between family relationships and family health. Medical family therapy attempts to treat illness first by recognizing that the treatment of family therapy simultaneously at several systematic levels such as biological, psychological, social, and interpersonal. Short-term educational programs. Programs designed to help families who wish to acquire better coping skills for managing everyday relationships more effectively or preventing the occurrence of problems before they develop. Programs involving relationship enhancement, preparation for marriage or childbirth, marriage enrichment, and parent effectiveness training are all examples of these psychoeducational efforts. In some cases, with the short-term educational program, some may wish to learn how best to prevent the occurrence of problems before they even develop. This concludes my presentation of psychoeducational family therapy.